plant seeds rather than to prescribe. But ultimately, what does this mean for health professionals? And I got a list there kind of at the end of your outline. That's kind of, as I've thought about what does it mean for health professionals, this is sort of what I've arrived at as a starting point, or maybe some good ideas. So I think that it means thinking about people's environments, and not just as individuals, but also in their environments. That's really hard. I don't know what it's like to be a pharmacist. I haven't actually given a lot of talked with a lot of pharmacists, but I believe we have a lot of pharmacists in the, a lot of people doing pharmacy. Oh, just two? Okay. For some reason I thought we had a lot. But as doctors, I know, the way healthcare works, or health insurance works, it's, man, you got to pump them through, right? You just got to push them through. As many as you can, just put them through. You don't have time to be thinking about environments and their home situation. You don't have time for any of that. I think I think that's the kind of thing that you could potentially think about over a decade or 2 decades. And so you're commuting home. What if you gave it some thought just for a couple minutes? Not about maybe a specific patient, but about the patients you see generally. What's their environment like? How's that impact them? How's that impact their health? How's that impact pediatrics or whatever area you're in? And I don't know. I don't think it's like that'll necessarily lead to something immediately. But over 2 decades, I think you'll be doing things very differently if you give that thought every now and again. And so what does that look like? To consider environments and not just people, not just individuals. So that's part of it, right? Healthy environment as well as populating with healthy people. And then again, what does it mean to create health? Access to primary care is huge in Philadelphia. I looked up statistics a couple years ago, and I haven't reviewed them, so this is really kind of off the top of my head as I recall. I think there was something like 8,800 doctors in Philadelphia. And 119 of them are primary care physicians. Now nationwide, there was something like 40% of all doctors nationwide are primary care physicians. Why are there so few in Philly? Because it doesn't make any money. In fact, it loses money. So everybody specializes. And so there's no money to be made in primary care. But I think it's a real problem. I think access to primary care is a real problem. And in dentistry, in Center City, Philadelphia, there's this whole movement happening now of what they call concierge dentistry. Have you guys ever heard of this? Basically, in concierge service or dentistry, the wealthy can buy into a practice, become a member of a practice. So there might be a dental practice, and what that dental practice will do is that they will limit the number of patients they accept. And it's not driven by this just rapid push people through sort of insurance. But what happens is the wealthy buy into it, so that makes it a profitable business with fewer patients. And they still get insurance money and all the rest, right? But that's great for the wealthy. But what would it look like as Christian physicians or dentists or healthcare providers to start a practice with 5 other or 4 other physicians and take a day, do a concierge practice, make yourself profitable, right? The numbers have to work. So take each of you, rotate a day in an underserved community like Hunting Park, and start a practice there too, an extension practice where you do it no charge, or you do something like Esperanza where it's tiered, but where you can do family practice that's profitable or at least sustainable. These are the kinds of things, right, that hopefully we can begin to think about. To create health in a city, what does the city need? Health, nutrition, and wellness education. I mean, that's huge. If you remember Michelle Obama with her whole soft drinks, diabetes program that she was rolling out, Philly was the first place she came because we're morbidly obese in Philadelphia. right? But so what would it look like to just volunteer or set up a program at a church in the inner city or someplace where the education isn't so good, and just do some education over time, and maybe do it with some others, so the burden isn't too much on you. And then I think the third thing that I give a lot of thought to is to shape the institutions that shape the city. The University of Pennsylvania shapes Philadelphia more than any other single institution in Philadelphia. It's got this med school, it's got the dental school, it's got all these, Philadelphia has more medical schools than any city in the country, as I understand it. In fact, so Susan Post says, and maybe Laura Lair told me this. You'll probably meet her if you haven't. She said 25% of all physicians nationwide have done some of their training in Philadelphia. 25%. This city is a healthcare city. And what would it look like as, to even now begin thinking about what would it look like for some of you to become those who shape healthcare in Philadelphia? You're gonna go through these programs, and you're going to come out, and some of you are going to find yourselves as faculty, like Karen, and I don't know if you guys are faculty at Drexel, but Karen is, and at City Line we have a lot of faculty, not a lot, but percentage-wise, at various universities and med schools. And what does it look like to even now begin thinking about how do you shape how these schools operate? How they treat their employees, how they create health for the city. So these are the kinds of questions that hopefully we can spend decades wrestling out in community, discussing them with one another. Wouldn't that be great? That's all I got. So any questions? It's not 8:30 yet, but any questions or comments? Comments are welcome too.
That's great. Thank you.
So tomorrow we will begin with a more inductive approach, and a lot more discussion. Thursday.
Thursday.
Yeah.
Thank you.
Thank you.
Thank you.
How you doing?
Yep. Good.
So,
Yeah.